Hi everyone, my name is Natasha McKnight, and I decided to do my human sexuality project on Klinefelter syndrome, which is also known as XXY syndrome. So first of all, I'm briefly going to go over a little bit about what Klinefelter syndrome is. So it's a chromosomal condition in males that affects cognitive and physical development. Males with this condition have 2 or more X chromosomes. They experience hypogonadism, which is a condition when the body doesn't produce enough testosterone, and that hormone plays a key role in growth and development in males during puberty. Nearly all males with this condition have low levels of testosterone, which obviously leads to less muscle, hair, sexual interest, and function. Pretty much every male with this syndrome cannot produce offspring with a woman without the help from a fertility specialist. The chromosomes are present in every cell of the body, and the extra X chromosome cannot be removed. Typically, men with this condition have lower levels of energy, and it affects about 1 in 400 to 800 men. So I'm briefly going to go over a little bit about the history of Klinefelter syndrome. So it was first discovered by a man who was named Harry Klinefelter, who discovered the syndrome in the 1940s. The extra X chromosome, it wasn't first identified until 1956. Mice can have Klinefelter syndrome too, which means they are very useful when doing research on this particular syndrome. So I'm going to be talking a little bit about the physical characteristics of Klinefelter syndrome. So men can experience gynecomastia, which is when the breast tissue swells due to hormonal imbalances of estrogen and testosterone. So some men with this syndrome may experience pain in their breasts and feel embarrassed by the fact that they have what we call man boobs in our society today. They have taller, less muscular bodies, smaller penis and testes, weaker bones, and reduced muscle tone, which puts them at greater risk for bone fractures, and they also may be at risk of developing osteoporosis. Less facial hair, which is due to low levels of testosterone, longer legs, and wider hips. And this right here is just an image comparing your abnormal XXY male to your normal XY male. Intelligence and language. Some individuals with KS have intellectual disabilities. Verbal IQ scores are generally lower, but they're not lower by that much. So the Wechsler Intelligence Scale, it's used to measure intelligence. I'm sure a lot of you are aware of it from your previous psychology courses. And that particular intelligence scale was used in a study that found that those with Klinefelter syndrome scored about 10 points lower in comparison to peers and siblings without KS. Language disabilities are estimated to affect 70 to 80% of males with XXY syndrome. Difficulties in the articulation of sounds, syllables, and processing phonemes are common in people with KS. These difficulties have an impact on reading, writing, math, expression, and reasoning abilities. The restrictions of communication can have an impact on behavioral aspects, social adaptation, as well as the development of personality. Between 60 to 86% of students with KS receive some form of special education. Verbal difficulties appear in earlier years, and from age 7, children have issues in reading, writing, and language, and it can range anywhere from moderate to severe. Attention and executive function. Executive skills are basically a set of mental skills that help individuals get things done. From an observational perspective, some children with KS are seen to be hyperactive. They have difficulties in short-term memory and concentration. On the other hand, some children with KS have a very low activity level and are much more submissive. So executive function deficits have been identified in children and adults with KS, although there really needs to be a lot more research done in this particular field. Psychosocial development and factors influencing quality of life. Men from across Australia that were diagnosed with KS were recruited to participate in a study. So in the study, there was 87 men that completed a questionnaire which asked them questions about their self-esteem, body image, mental health, general health, social support, and subjective well-being. All of the men with KS scored a lot poorer in comparison to the general population. Social support, employment status, and phenotypic features were the strongest predictors of psychosocial outcomes. and this was the first quantitative study to show that Klinefelter syndrome has a significant personal impact. Personality. So some men with Klinefelter syndrome may be shy and not as assertive. They may be immature in comparison to their peers during puberty. They may lack self-confidence, may have a difficult time forming social relationships, may appear to be friendly, polite, calm, or sensitive, anxious, and insecure. X-chromosomal abnormality and schizophrenia. So there was a study that compared levels on the schizophrenia spectrum of 32 males with KS to 26 healthy controls. Schizophrenia spectrum traits were measured using the schizotypal personality questionnaire. It was found that those that scored higher were individuals with Klinefelter syndrome, suggesting that there is a link between the X chromosomal abnormality and schizophrenia. So this right here is just a graph that I took from the study, and it's you see in the black it's the Klinefelter group and the white is the control group. So as you can see right there, the Klinefelter group obviously was a lot higher. So these are some treatment options for people with Klinefelter syndrome. So the first treatment option is testosterone replacement therapy, which can improve bone density and help reduce the risk of fractures. It can also help with stimulating changes that would normally occur during puberty, such as developing a deeper voice, growing body and facial hair, increasing muscle mass, and penis size. So the next one is breast tissue removal. So that's just removing all the excess fat to reduce the size of the breasts. So as you see, A, that's before hormone therapy, and B, that's after hormone therapy. So you have speech and physical therapy. You have psychological counseling, educational support. And this is my bibliography, and that's the end of my presentation, and thank you all for watching.